Is it just me or am I an old school nurse? If you didn't chart it, you didn't do it. So I know in 2026 there are so many ways to like communicate with one another when you're working in healthcare, right? You might have some sort of instant messaging at your job. You might have secure tiger texts, obviously phone calls. There's so many ways to communicate things, right? Um, Little background, I came from a time in nursing. When I started out, we were still doing paper charts. We still have paper charts, paper mars. So you know one place to document what was going on with the patient, right? So back to the subject at hand, right? There's so many ways to communicate now. um I still am a firm believer that it doesn't matter how many different ways there are to communicate about a patient. Their chart should always absolutely be the hub of all their information. All their information should be housed in a chart. If something happened, you did something with the patient, you got new orders, whatever it is, it should be documented in the chart, because that is where one of your other team members is going to go, right? If you go to court, that's the documentation that they're going to pull up. So, there are so many ways to communicate, but really it should be in the chart. And I know for me personally, professionally, if I'm dealing with something with a patient that I take care of personally, or I am referencing something because I'm dealing with something on call after hours or whatnot, the chart is where I'm going to go. And that's where the information should be. So, yes, you can communicate in all these different forms, but the information should be in the chart for me to find, that houses the patient's name, date of birth, all their information. That's just my opinion. What are your thoughts? Do you feel overwhelmed with all the different ways that you communicate now? And are you finding, because yes, I'll throw in, right? Communicating, it having all these different ways to communicate, right? It just adds one more layer of like, well, shoot, now I got to go back to the chart. But remember, if it's not in the chart, how do we all know? How do we all collaborate, right? If you had to go to court, what are they going to look at? So just keep that in mind, and give me your take on just the different ways of communicating now if you came from paper charting.